Welcome everybody. We're going to talk about one of my favorite topics again. I'm continuing on with cranial nerves, and I've touched on a little bit of this already about how important this information is. This should be something that stays with you. This is not information that you want to learn quickly for a test and forget. Cranial nerves are something that you should use throughout your medical career. You're going to be using these constantly when you assess patients, how they're functioning. You're doing this without recognizing what it is that you're looking at. So cranial nerves, very important that we understand the basics. So I'm going to go back and remind you that there are 12 pair. That means there are 12 on the right, 12 on the left. Okay. Again, some of these will be pure sensory, some are pure motor, some are mixed, meaning that they carry sensory information to the brain and motor information back to either a gland or a muscle of some sort. So again, you want to get this kind of information in your head. We're moving on to some of the more interesting ones today, ones that have a little bit more to them. We've already picked up number 5, which was a mixed nerve. Number 7 is also mixed, has a lot of things that it's doing. First off, every time you pick up a cranial nerve, you're going to learn its number 7. I expect you to know the Roman numeral as well as the regular, everyday kind of numbers. All right, number 7. You're going to be expected to know the name. So number 7 is the facial nerve. Now, when you hear facial, you do want to think about the face. But in this case, it's motor. All right. Now, sensory information from the face was number 5. Okay. All that sensation, someone touching your face, pain in the teeth, all of those sensory information was coming through number 5. But now, when we talk about number 7, we are talking about something to do with the face, obviously. It's a little bit different. So the first thing I want you to think about is smiling, okay? I know, a real smile, but facial expression, okay? We do so much with our face. When you look at someone, when you first meet someone, you see their facial expressions. When you tell them something, you try to gauge how they're reacting by their expressions. So a lot of our brain is incorporated in making those expressions and then interpreting those. So we do have quite a bit of control over these muscles. And so number 1, when you hear facial nerve, I want you to think of smiling, expressions, facial. Okay, so facial expression. So there are branches to muscles of facial expression. So all of these muscles that control lifting your eyebrows, smiling, anything that you, all these just variety of expressions that you can make. Now it also has motor to glands. Remember, motor neurons carry information to 3 effector organs: muscles, which is easy to understand, glands, and other neurons. In this case, they're going to your not all of your salivary glands, but some of them. Your lacrimal glands, which are your tears. So again, this is not under your control, correct? This is autonomic nervous system, but again, it is motor. We are controlling when this occurs. And we do have sensory information. This is what makes this a mixed nerve. We're carrying information from the anterior tongue, but only about taste. Sometimes these get really, really specific. It's only the very front portion of the tongue, the sense of taste there. Okay, so again, we've got some little picky points here with number 7. Now, if we look at the salivary glands, again, we're seeing cranial nerve number 7 coming in from the brainstem, and it's going to control when the tears are released. Now, this is not just when you're upset and you're crying, but you're always producing tears at a continuous rate, and it is controlled by this particular branch of number 7. It's also some of these submandibular glands that are constantly producing enough saliva. So again, this is not under conscious control, so it would be the autonomic nervous system. Now, if we look at some things that can go wrong, you may have heard of Bell's palsy. This is a lack of control over cranial nerve number 7. Typically, it can be a viral infection or it can be trauma, whatever can damage this particular cranial nerve. And again, remember, cranial nerves are on one side of the face. So this particular side here, this would be the left cranial nerve number 7 has been affected. Supposedly, George Clooney here had a case of it at one time. But you're going to notice that this patient can't control their eyelid very well. The muscles controlling the upper area of the forehead, the eyelid will tend to droop. You won't be able to smile on that side. You're going to lose control of tears. So you're going to have too many tears. You might have that eye be draining. And again, in this case, it's going to stop or shut down saliva production. Now this patient, she's trying to smile. So this side, the right cranial nerve number 7 is working like it should. this side is not. So she looks kind of slack-faced. She has an uneven smile. So it's very easy to test a patient for that. So overall, if you're testing for this, you ask the patient to raise their eyes, try to shut their eyes, try to puff out their cheeks to test their cheek muscles, smile, show their teeth, and you could put a little something like a sugar cube or something on the front part of the anterior part of their tongue and see if they can taste it. Now again, I'm going to expect you to be able to pick this out on a diagram. So if we're coming down in order, remember they're all on one side. So number 1 is always easy to find. Number 2 is your optic nerve. Number 3 will come between the midbrain and the pons. And then we start around going with number 4. Number 5 is always the largest. You'll start to see the 3 branches. Number 6 comes out between the pons and the medulla oblongata. Okay. And then number 7 comes out in order right alongside, as you would expect. Okay. Now number 8 is the vestibulocochlear nerve. It's a very long name, but it's indicating the 2 major parts of this particular nerve. Now when we get to the sensory organs, we'll talk more about the ear and what the vestibule is and the cochlea. But the cochlea is this snail-shaped part of the ear where we actually process sounds. So this portion of the ear is picking up sensory information, your sense of hearing. Okay? Now the vestibule, this is involved in your sense of balance. So this is going to be your body position of your head. And again, this is sensory information going up into the brain. So all of this will be sensory information coming in. So we combine these two and they become vestibulocochlear. And I had one student say that they concentrated on the ear part at the very last to help spell it and to help put it with the ear. Okay. And again, it comes out in order on the brainstem, just as you would expect. Here would be 6, 7, and here would be 8. Now, next is number 9. This is also a mixed nerve, meaning it's going to have sensory and motor information, a little bit more complicated. Now, if you look at the word itself, glossopharyngeal. Glosso means tongue. Okay, we're going to see this twice, so it's a good idea to go ahead and put that somewhere in your brain. Glosso is referring to tongue. Pharynx, if you're not familiar with that word, that is another word for the common word would be throat. So the back of the throat, the pharynx, this portion. So again, that's going to help you start thinking about where this would be. Now, sensory information is going to include all the general sensory information from the back of the throat and the back of the tongue. So this means pressure, the sense of food passing through, pain as well. Maybe if you have a sore throat, this nerve's going to be carrying all that information. If you have strep throat, something like that. It's going to include pressure, and it's going to pick up taste from the posterior tongue. All this is sensory information going to the brain. Okay. Now, motor, on the other hand, we're going to control something. So primarily, the one I want you to know about is that it controls the swallowing. That first portion, when you swallow, that's voluntary. We can make a decision when to swallow. From then on, down the esophagus, is autonomic nervous system. We don't consciously control it. But at this point, the motor to those pharyngeal muscles that start the swallowing process, that will be controlled by number 9. All right, and I put this slide together to show you that taste is broken up into 2 cranial nerves. Anterior tongue is going to be carried by number 7. Posterior tongue taste is going to be carried by number 9. Okay, so 7 and 9 are dealing with sensations of taste from your tongue. Now this is the same patient, I believe, who had a problem already with, I think it was cranial nerve number 6. He's had a stroke. So not only did he have problems with number 6, but now we see that he has trouble with number 9. So this is when you have a patient say, definitely not checking for their teeth. They're looking back here at the uvula. Now, normally the uvula hangs down straight. On this patient, you can see it's deviating toward one side. Now, you also have to take into account, we're controlling swallowing with number 9, but it's impossible for someone to open their mouth and swallow at the same time. You cannot test that on a patient. And you can try this at home, see what happens. You open your mouth, try to swallow, it's not going to happen. So basically what happens when you swallow is muscles here are going to pull on that hyoid and lift that portion of the throat. Okay? The upper soft palate is going to lift up, close off the airway, because we don't want food coming out your nose. So all of that happens very, very quickly, all coordinated. But in patients who have a problem with cranial nerve number 9, they can't do that like they should. So they might complain of trouble swallowing. Now, when you have them say, ah, and you look back and you see how the uvula is positioned, if it's straight, then we know everything's fine. But in this case, it's going toward the right. Now, what that means is that his right side is still getting the message, right? It's still contracting. Left side, on the other hand, is not carrying the signal. So these muscles on his left side don't contract. So what's going to happen is that the muscles that are getting the signal are going to pull on it, and it will deviate toward that side. Okay. All right. Now, again, in position, it comes out in order. We have 6, 7, 8, and 9. So you can find it pretty quickly on the brain. All right, number 10 is our next. This is called the vagus nerve. This is the only one that's going to pass below the level of the neck. Now, it gets the name vagus because it's like a vagrant, someone who wanders around all over the place. Because this particular nerve is going to go to so many different organs within the thoracic and abdominal region. So you're going to see that this travels and is carrying mixed information. We've got sensory from these organs. So if you feel like your stomach is full, your stomach hurts, we can feel these sensations that are carried by number 10. Now you have to control the rate of everything. We have to control how fast the heart is working, how fast the lungs are breathing, how we're processing all of this through the intestinal system. How do we keep these smooth muscles squeezing to pass food through the intestines? So all of this is being controlled by fibers that are carried by the vagus nerve. All right, and if you look for this one on here, again, it's coming out in order. Here it will be number 10 as it comes out of the brainstem. Now, number 11 is called the accessory nerve. It is primarily motor to our sternocleidomastoid and the trapezius muscles. So very simple what it does, but it has some interesting facts associated with it. Now, I'm going to say primarily motor with some of these. Now, we did have some that were pure motor. But this one and number 12, they are primarily motor. And what I mean by that is that, yes, they do control muscles. But we do have a little bit of sensation coming back up called proprioception. And I have not introduced this topic yet. I will. But this is our body position, our sense of what the muscles are doing. So this is feedback coming back from that muscle saying, I did contract. This is the position that I'm in. So I'll say primarily motor for this one. Now this one is an unusual nerve because the rootlets are coming out actually from the spinal cord. So it's, strangely enough, this is past the foramen magnum. So all these little rootlets are going to combine and they actually go back up through the foramen magnum back into the skull, the base of the skull here, and then they go back out. So it's a kind of a strange cranial nerve, and some people have debated whether or not this should be a cranial nerve. But for our purposes, it's number 11. Now, for the females out there, accessory, you may want to think about the accessory department in a department store where they have necklaces and scarves, and that might make you think about the neck. A lot of different ways that you can remember things. Whatever helps is the best, of course. Now, if you're checking your patient, you can put both hands on the shoulder and ask the patient to shrug their shoulders. And if they can't control the trapezius, one shoulder may be weak or not able to move at all. You can put one hand on either side of the face and ask the patient to try to resist your hand. And if they can't turn their head very well, they are not controlling the SCM muscle for that side. So we can check this cranial nerve fairly easily. And again, it's a strange one. It's going to come out in a very different, very obvious if you know about this. So you're going to know that this nerve here with all the little rootlets coming out from the spinal cord will be number 11. And it is in order, but it is a little bit different position. So all of the cranial nerves, the nuclei, the clusters of their cell bodies are within the brainstem except for 11. Now our last one is called the hypoglossal. Again, glosso means tongue. Hypo means below or under. So in this case, we're dealing with the cranial nerve that controls muscles to your tongue and the floor of the mouth. Now, again, it's primarily motor. It is going to pick up some proprioception from this. Now, it's not, the tongue does a lot for us. It's involved in speech. It is involved in chewing. You've definitely got to position the food during chewing, and we all know what happens if something goes wrong and you accidentally bite your tongue, you bite your cheek. All right, most of the time, we coordinate this very well. Okay? And remember, we've got two. We've got a number 12 on the right and a number 12 on the left. So coordination of this. Now, if a normal person wants to stick their tongue out, both cranial nerve number 12 are going to carry the signal at the same time, and you're equally going to affect both sides. Okay? Now, here's an interesting question. I've been telling you that muscles only pull. That was back in Unit 3, and that's true. So the tongue is a very strange muscle. There's nothing on the other end of it. There's no bone. There's no insertion point if you think about this as muscle, because tongue is muscle. Okay, so you have to look at this a little closely to understand how to answer that question. If we look at the floor of the mouth, there's a very large fan-shaped muscle that originates inside the mandible, right here, all right, and it inserts into the part of the tongue and these other muscles. So whenever it pulls, it's going to pull on the base of the tongue and literally pull the tongue forward. So that makes sense, right? It's pulling. You also have to understand the tongue is a very strange muscle. Most of the time, muscle fibers run in one direction because they pull in one direction. But the tongue does all kind of things for us. Right? It's moving side to side, up and down. It has all three directions of fibers. So we have fibers running basically front to back, up and down, and oblique. So you can position that tongue in any position possible during chewing. Now, when you want to stick the tongue out, you're going to do a combination of things. You're going to contract the vertical fibers and the horizontal fibers, and so what's happening is that tongue's getting narrower and longer. And then you pull, the genial glossus contracts and literally pulls the base of the tongue, so that narrow tongue now comes out. Because we know in normal position, the tongue is going to assume the whole oral cavity. It basically expands and fills the cavity, and it's kind of flattened out and rounded at the front. But when we stick the tongue out, it changes shape, comes outward. So it's a combination of a lot of things going on at once. And these are controlled by, you guessed it, number 12. So if we do things normally, and both number 12s are working like they should, it happens like it should. Now here we've got this poor same guy. He's had trouble with number 6 and number 9, and now we find out he can't stick his tongue straight out. So he's been having problems on the left every time. He's had a stroke. He's had an area of the brain that lost its blood supply and has died. And it happens that it's in the area where these cranial nerves, where their cell bodies are resting. So these cranial nerves can't send a signal anymore. So now you tell this patient to stick his tongue straight out, and he tries. He sends a signal. All right. Now, why is it going to one side? Well, the right side, remember, cranial nerves go to the side that they carry the information to. So the right cranial nerves are doing their job. The right nerve sends its signal, tells that tongue to stick out straight, and he tries. But unfortunately, the left side's not getting a signal at all. So the right side, in effect, becomes much stronger, and it pushes, and it kind of goes toward the side that's not getting a signal. So that's why you're going to see a deviation toward the side that is affected. Okay. All right. So when you ask yourself again, why are they making me stick out my tongue, say ah? Why are they making me follow a finger? They're looking for basic information about cranial nerves. Where's the damage? Okay. And again, last but not least, number 12 comes out of order. All right. So when you're looking at these diagrams of the brain, number 12 is actually right on top of the medulla oblongata. So again, 6 is here, 7, 8, 9, 10, 11 with the rootlets, and 12 right here on top of the medulla oblongata. So you need to, of course, know the parts of the brainstem and understand where these cranial nerves are coming out. Now, last but not least, there's lots of different ways to start memorizing this. A lot of people like mnemonics. They go with something like this so that they can learn the first letter of all 12 and keep them in order. And that's a great place to start. You have to find what works for you. At some point, though, it's going to start to get easier. But one other method is to rewrite these over and over. That helps. Okay. Now, this is a nice picture here. If you can print this out and cover up the names, that's also a good way to test yourself. You can make like a little card and cover up the names. This one prints out beautifully. You've got color if you want it, and very, very nice image. So I hope you've enjoyed cranial nerves. Please go back to the book and read the pages on there, and I will see you later.